Good morning, amazing people. My name is Mark John Paul Utan, and I will be reporting about anatomy and physiology of reproduction, and my due courtesy and respect to our subject teacher in gender and society, Mrs. Baiwina Eto Cueto. Alright, so once again, my topic for this report is all about anatomy and physiology of reproduction. Before digging into the topics and to the subtopics, and for elaboration, more explanation, allow me first to introduce to you the lesson objectives. First is differentiate the female and the male reproductive systems. Second would be understand the basis for physiologic processes in female and male. So those are our targets at the end of this report. Alright, let's proceed. So, human experience various physical and emotional changes from childhood to adulthood. These changes are gradual and progress at different ages and speed in different people. These stages are based on human growth and development from adulthood, childhood, or and old age. Alright, so by that means my topic would be all about human growth and development, and it's pivotal for us to know and to embrace these stages or the processes, and everyone are required and obliged to undergo that. Whether you like it or not, we have to undergo to that process from infancy, childhood, being a toddler, being adulthood, or becoming an old age, or even as a sleeper pantaloon. Anyways, now a lot of people are having hard times embracing those changes, but we have to, once again, we have to embrace that individuality. Why? First things first, it's part of human development and growth. First things first, why we need to undergo to that process. Once again, it's innate. When we say innate, it's natural to every human being. If you're familiar with William Shakespeare's poem, which is entitled as The Seven Stages of Men, you will know there why we should undergo to those processes, why we should undergo to those stages. But nothing to worry about, because that is part of our development as a human being. You will never ever grow, you will never develop unless you accept those stages, you embrace it wholeheartedly. Alright, let's move on to the other topic. But we have to differentiate first what is anatomy and what is physiology. Now, as I can see here, anatomy, it is a branch focuses on the structure and organization of living organisms, while physiology, on the other hand, is concerned with the functioning and processes of living organisms. So what does that mean? It means that when we say anatomy, this talks about the branches that studies, or it is a study of the structures of an organisms, while on the other hand, physiology means, or physiology delves into how those structures function to maintain life of an individual. Alright, now, as you can see here, despite differences in physical appearance, the sexual organs of men and women arise from the same structures and fulfill similar functions. Now, what does that mean? So it means that while men and women share some common embryonic origins in their sexual organs, so there are really differences, but there are also some similarities for them. Now, how do they differ? Now, there are significant differences in terms of the function, on its size, and specific structures which are adapted to their respective reproductive roles. Alright, so there is a question here. What do you think is the hardest stage of human growth and development for you? What do you think is the hardest part, or the hardest stage of human growth and development? If you may ask me, it would be the adolescent, because it is the time of curiosity. It is the stage of curiosity. Now, a lot of teenagers, because of their curiosity, they are making some fatal activities without even thinking those consequences, like having curiosity about sex. So most of the teenagers nowadays are having this teenage pregnancy, which is one of the top and major concerns of teenagers nowadays. And so as for the drug and alcohol beverages or the drug addiction, drinking alcoholic drinks even if they are still minor. So on that age, there are really a lot of um, concerns of teenagers. They are being tempted because they are being pressured by their peers. So I believe that's definitely one of the hardest stages of the human growth and development, because you have to think critically for you to not make any drastic decisions. And it's also a time for the identity crisis. I believe it's most of the teenagers when they are adolescent, they're having hard time identifying themselves, who they are and what they are. Alright, so as I have said a while ago, for me, one of the biggest challenge, one of the biggest, challenge for human growth and development is the stage of adolescent, because we are experiencing the emotional roller coaster. So we tend to be bipolar sometimes when we are adolescent because of those curiosities, because we really want to try something, but we are not thinking of what would be the consequences out of that action. Next would be the peer pressure. I believe this is timely and relevant nowadays, because a lot of teenagers right now are being pressured by their peers, so that's why they tend to do some things which is bad for them. Because they are pressured by their peers, they're going to make it. That's really, really a bad thing. Alright, and the identity formation, as I've said a while ago, in adolescent stage, that's the time that teenagers are having hard time identifying themselves. So it's a time for identity crisis. But what would be my advice is that be who you are, be true to yourself, be the best version of yourself, or be the first rate version of yourself rather than a second rate version of somebody else, and authenticity means everything for that. Let's go to the biological female. So I believe this has been one of your topics before when you were elementary, or when we are elementary. So this is very understandable. I just have to read this because most of the terms here are quite familiar. Alright, so let's proceed. Now, anatomy, the study of body structure in relation to body parts. The female sexual anatomy is designed for the production and fertilization of ovum, as well as carrying and delivering infant offspring. Puberty signals the final development of primary and accessory organs that support the reproduction. So I already defined to you earlier the meaning of anatomy, which is it deals with the study of the structure in relation to body parts. Again, this is a study of the structure. And the physiology, it tells us the functions of those structures, how to maintain life. Alright, so in order for you to be informed or to be educated by some parts of the female reproductive system, allow me to read this one to you. So, may I lend your ears at this moment? Let's start first with the vulva. All the external genital structures are taken together. Next is the Vons veneris. These are pads of fatty tissue between pubic bone and skin. So it's between the pubic bone and skin, and it's just like a fatty tissue surrounded by it. Next would be a labia majora, or these are the outer lips surrounding all the structures. So I believe that is close to the clitoris. That is just like the a lip shaped on the vagina. That's the labia majora. Okay. Now the prepuce is the clitoral hood, and then the clitoris. These are particularly sensitive to stimulation. Labia minora is the inner lip surrounding the vestibule, where sweat and oil glands extensive. Blood vessels and nerve endings are located. So in labia minora, it's an inner lips where those sweat and oil glands and extensive blood vessels, and so as for the nerve endings, it's located at labia minora. Next would be the vestibule. It's an area surrounding the urethral opening and the vagina, which is highly sensitive with extensive blood vessels and nerve endings. So vestibule, it's surrounded, or it's surrounding the urethral area, so it's sensitive. So girls, you must always be hygienic when it comes to your private parts, most importantly with those sensitive parts. Okay? Alright. Next would be the urethral opening. This is the end of the tube connecting to bladder and used for urination, or for what we call in Tagalog ihi, for ihi purposes. Okay, last would be the no, second to the last would be vaginal opening, also called as introitus. Remember, it is also called as introitus, the vaginal opening. The perineum, it is an area of skin separating the genitalia from the anus. Again, the perineum, I believe it's at the bottom. It is separating the genitalia or the reproductive part of the female from the anus. Alright, at this moment, let's talk about puberty. I know all of you know this word. But allow me to read this first. The menstrual cycle marks the beginning of puberty in females. The first episode occurs when 11 to 15 years of age, referred to as a menarche or menarche. Correct me if I'm wrong. Menstruation pertains to the sloughing of the uterine lining if conception has not occurred. The overall cycle is governed by the hypothalamus as it monitors hormone levels in the bloodstream. So during puberty, I know that you can observe some changes in your physical aspect, because in female, if they are reaching puberty, of course one of the signals would be the menstruation. Next would be their breast, it's enlarging, and of course the emotional roller coaster, that's also part of it. And for males like me, so if we reach the puberty, it changes our voice, it becomes deeper, and we also have or we also tend to have this mustache and beards, and some pubic hairs at some private parts as well. So in puberty states, expect that there are some changes in your physical appearance. Alright, so as I've said a while ago, it's necessary for us to undergo with this stage, which is puberty. Why? Because undergoing puberty is critical and natural part of human development. So again, it's natural, ladies and gentlemen. Whether you like it or not, you have to undergo to this process. Now, puberty is essential for an individual's overall well-being and their ability to participate in the continuation of the human species through reproduction. Alright, let's move on to the menstrual phases. First would be the proliferative phase. So it occurs when the hypothalamus stimulates the pituitary gland to release the FSH that stimulates the ovaries to produce estrogen and causes ova to mature in the ovarian follicles. Now let's go ahead and dig deeper into this proliferative phase. So when we say proliferative phase, it occurs during the first half. Again, it occurs during the first half of the menstrual cycle, typically lasting from the end of menstruation to ovulation, which is the release of a mature egg from the ovary. So I believe this phase sets the stage for potential fertilization and, of course, the implantation of an embryo by providing a nourishing and supportive environment in the uterus. Let's move on with the secretory phase. It occurs when the pituitary gland releases LH that causes the ovary to release a mature ovum and cause the remaining portion of the follicle to develop into the corpus luteum. Now, if you can remember, as I've said, with the proliferative phase, it occurs during the first half of the menstrual cycle. Now here in secretory phase, it occurs during the second half of the menstrual cycle, from ovulation to the onset of menstruation. So that's the secretory phase. However, infertilization does occur. Progesterone production is maintained to support the early stages of pregnancy. Right, so let's move on to the female secondary sexual characteristics emerge after puberty. Now, after puberty, as I've said a while ago, expect that there are some changes. Now, for female, widening hips and pelvis, it accommodates giving birth, but also results in downward shift in center of gravity. Of course, in some, as I've said a while ago, females after puberty expect some changes, specifically with your physical appearance, like widening hips and pelvis. Enlargement of breasts, that's also included. At puberty, both glandular and fatty tissues of the breasts develop considerably, so it changes its size. Okay? Alright, so let's move on to anatomy of a woman breast. So as you can see here on the presentation, we have the fat, the lobules, which are the grape-like, thingy, and the anatomy of the woman breast. The ducts, or which are those lines or those veins connected to the lobules. And we have the areola. I believe it is surrounded, or the nipple is surrounded by these what we call areola. So we have here the side view and the front view for you to be able to look for it, understand it. We have here the side view and the front view. There you go. Our report is getting more exciting because we will now be moving on to the biological male, I'm so sorry. The male sexual anatomy is designed for the production and delivery of sperm. For fertilization of the female's ovum, puberty signals the final development of primary and accessory organs that support the reproduction. So we're going to scrutinize here about the biological male, specifically their parts of the reproductive systems and the functions of it as well. Alright, so we have here the prepuce, or the foreskin covering head of penis, removed in male circumcision. Now the prepuce, it's the skin it's the skin that is covering the penis. It will be removed if a man or a male undergo a circumcision. Next is the penis, particularly sensitive to stimulation. That's the head. I'm sorry for the term, but that's the head. Okay, so it's sensitive to stimulation. It's sensitive, and it needs, males or men out there, please be hygienic, specifically to those sensitive parts of your reproductive system. Corona, it's a rim of glands where it arises from shaft. We have here as well the frenulum, thin strip of skin connecting to the glands and shaft, or underside of the penis. Scrotum is the sac that encloses the two compartment housing the testes. And then the urethral opening, found on head of penis, or the hole there. This is the end of tube connected to the bladder and used for urination or for the ihi. So I believe female has also urethral opening. So as I've said a while ago, there are differences in the function. There are differences in some parts of the genitalia of male and female, but there are also some similarities, like the urethral opening for male and the urethral opening as well for the female. But they do have the same functions as well. But some of those genitalias, or some of the parts, are really different. Okay? Alright, last with the perineum, area of skin separating the genitals from the anus. Distance is greater in males than females. Now, there is, I forgot the term, for the part of the genitalia of female, but in male there is what we call the perineum, which separates the genitalia of a male to the anus. So as we can read here, the distance of the genitalia from the anus is greater. Males have greater distance rather than female. We also have here an example of the circumcised penis and the uncircumcised penis. So you have to check what are the differences and the similarities. You can see here the foreskin. As I've said a while ago, these will be removed if the male has already undergone a circumcision. The scrotum covering the testis, the penis itself. Okay, now What is the difference between uncircumcised and a circumcised penis? A lot of people are saying that it's not hygienic for those who are not uncircumcised yet. But some also say that no, it depends on the people on how are they going to be hygienic. So is it really necessary to undergo circumcision in males? Why or why not? For me, it depends. It could be yes, it could be a no. Because some of those males have their situation, a specific situation, like religion. There are some religions that don't allow male to be circumcised, and we need to respect that one up. We need to respect diversity and respect for the other's religion. Okay. So, the testes produce androgen, particularly large quantities of testosterone, which greatly influence male development and drive sexual motivation. These are the function of some parts of the male reproductive system. Vas deferens, a transfer from testicle toward urethra, carrying the sperm. So, vas deferens, its functions is to carry the sperm toward urethra. Seminal vesicles, two glands that produce alkaline fluid rich in fructose sugar, comprising SOM 70% of semen volume. Ejaculatory ducts connect vas deferens to urethra. Prostate, it is a gland producing alkaline secretions that account for about 30% of semen volume. Lastly, urethra, tube within penis that carries sperm and semen the rest of the way to the opening of the penis. Alright, we're down to the last topic, which is male hormones. The testosterone is the major male hormone produced by the testis, but there are other glands called the adrenal glands that also produce some testosterone. Alright, let's go ahead and explain this. When we say male hormones, it is also called as androgens, and it is playing a crucial and a vital role in the development and maintenance of male sexual characteristics over health. Now, there are a lot of male hormones. One of that is the testosterone. It's the most important male hormones, and it is really responsible for the development of the male secondary level or secondary sexual characteristics such as facial, body hair, deepening of the voice, as I've said, some changes after puberty, and muscle growth. What else? These hormones or male hormones collectively regulate male sexual development, fertility, and other physiological processes. And it is particular, or in particular, it has a wide range of effects of the male or on the male body, including muscle mass, what else? Bone density, mood, and libido, among others. So imbalances in male hormones level can lead to various health issues, and it requires you to ask help from one of the medical professionals unless you undergo to that kind of situation. Alright, so I hope that you gain some knowledge and gain some information about this report. I'm not gonna take so much of your time. Enjoy the rest of the day. This is Marjan Paul Villardi Nautan. Bye for now.